There is a time and there is a season for everything under heaven. The Lord is making me into his vessel. But I'm coming into my now. I'm coming into my now. My mind is changing. My mind is shifting. Bless the Lord. Good afternoon, everybody. Good afternoon. A blessed Saturday. Yes. Happy Saturday, everybody. Happy Saturday. I really trust that you are doing well in the Lord. I trust that you're having a very good afternoon today. Yes, and all is well with you. How has your Saturday been going thus far? How has your Saturday been going thus far? Stacy, blessings to you. Invite your friends in the room. Today we will be looking at our oral hygiene. Yes, tag, put it in the comment. Oral hygiene. We'll be looking at our oral hygiene today. So I want you to invite your friends into the room. Simone, a blessed good afternoon to you. Angela Arthur, blessings to you. Good afternoon. Thank you very much for joining us. Rhonda Paul, how are you doing? How are you doing? Thank you very much for joining. Juliet Forbes, how are you? Thank you very much for tuning in this evening, this afternoon. So today we will be looking at our oral hygiene. How many of you know that this is very, very important? It's very important to our health. It's very important that we take good care of every aspect of our lives. And today we will be looking at how we can better care for our oral health. Yes, how we can better care. Good. Akim, good afternoon to you. Yes, Juliet, I'm happy that it's a blessed Saturday for you. Go right ahead. Tag. I'm not seeing Sadie. I'm not seeing Shondell, Fiona Adams. Come on, Natasha. Where is Tamiko? You guys, you need to join in this morning. If you missed this morning's exercise workout, you need to go look at the video again and be a part and do the routine. I'm telling you, that was a full body workout today, and we had fun doing it. So today, without further ado, continue to share this life, continue to invite your friends in the room. Let me tell you, invite as many persons as you can because we all need to know how we can better take care of our oral health, how we can better take care of our oral hygiene. And so with me to share and to encourage us and to let us know how important it is for us to take good care of our oral health or oral hygiene is none other than our dental student himself, Dr. David Adams. Sir, good afternoon to you and welcome once again to the Pastor K Show.
Good afternoon, Pastor Carly.
It's always a privilege when we have you in our midst. It's always a privilege when you can share with us such pertinent information, such information that we take casually, that we take lightly, that we overlook. And so I think it's very beneficial for us during quarantine time, especially to know what we can do, how we can do it, and how we should, take care of our oral health. So what will you be sharing with us today as it relates to our oral health? This is part three of oral hygiene.
Yes. Good afternoon, viewers. So, today we are focusing on how to overcome the fear of the dentist, which is a very
Mm,
important topic because many persons do not visit the dentist because they're fearful. And so, before we go any further and talk about, what to do to overcome oral hygiene practices and stuff like that, we need to first be able to overcome the fear of the dentist. So this is a
Awesome.
very necessary topic before we move any farther.
So, in order for us to overcome, well, in order for us to take care of our oral
Yeah.
hygiene, we need to overcome the fear of dentists. And many a times we are so fearful. Guys, if you have questions, feel free to post it in the comments. Good afternoon, Onika Beckles. This is the trainer. Good afternoon to you. Stacy, blessings to you. So if you have questions concerning your oral health or your oral hygiene, feel free to post it in the comments. We have the well capable and able doctor with us. Well, he's a medical student, but he's already our doctor. So we have him who's well able to answer. And if we do not know the answer right now, the thing is we can always research and get back to you. No harm in that. So go right ahead, doctor. Do not be afraid of the dentist. Many
Right.
a times we are so fearful because we think that the exercise, if we're going to do whatever we're going to do, it will be painful. They may not have the patience with us. Share with us why we need to overcome that fear of the dentist.
Yes. So the thing is, before many persons are afraid of the dentist because one, they're fearful of the pain that might come with it. Secondly, uh, they're afraid of the unknown as to what might occur, and I'm not in control, and so I'm fearful of what might happen. So that is one of the reasons why. Secondly, because they're feared that oh, I'm going to be judged because what's happening in my mouth, and so I don't want people to see or the dentist to see all that is happening in my mouth just because I want to save my repetition or whatever status you might have. And some persons generally have bad experiences with some dentists or wherever they have been to get treatment, and because of all these things adding up, it causes them to not want to visit the dentist. But let me just put it out there: going to the dentist, the treatments are not painful because in today modern day dentistry, there's pain free dental care because we do everything that we can without trying to cause any pain because we use anesthesia, meaning the injection that we would give. Most persons would say cocaine. It's not cocaine we use something anesthesia that we would use so as to numb the tooth or the area that we are going to work on. Basically, put the area to sleep so it doesn't feel you don't feel what's happening. So just do away with that. There's no pain when it comes to dentistry. When it comes to dentistry, we just seek to come and help you. So just go away with that. And you don't have to worry about being judged because the dentist we've seen so many different cases that we're accustomed to, and so your case isn't going to be something different. And we would have studied it, we would have read it all the time, watched videos, and so it's a norm. So you don't have to be afraid of that. So that is one of the there are some of the reasons why some people are afraid of the dentist. But how to overcome it? Um, there's many ways or many things that we can do, the dentist and you viewers can do to minimize the fear of the dentist. And the first thing is to speak to friends and speak to family members who might have a special dentist that they would go to. So if I say, Caroline, I have a problem and I want to go to a dentist, who do you recommend? You ask family member who they recommend because they might share some experience with somebody before, and they might say, "Oh, don't go to this person, don't go to that person. That person is really good," because they would have had a good repetition with that person. So it's necessary that you find out, ask questions, do your researches before. And on that same note, there's some people that would go to random dentists or random places. Like there's some places that you find underneath houses that would do the same job that the dentists do. Be careful of that. We usually would call them the dental quacks, meaning that they can do. Some persons just look and can do certain things, and then they open up a shop or so, and then say, "Oh, I'm giving dental services." Ensure before you go to the clinic or you go to the dental clinic or the hospital, you do your research, you ask questions from people, and ensure that there's some form of qualifications that they might have on their wall, on their business, wherever, so that you can be rest assured that oh, I'm going to an actual dentist because there's different people in the dental settings that would help. There's a dental surgeon, there's a dental nurse, there's a dental assistant, and many persons just open clinics just like that, and then work on people. And because of this, many persons go to these what we would call quacks, go to them, have a bad experience, and then they blame it on the entire dental fraternity. And oh, the dentists are bad or the dental surgeons in Guyana don't know what they're doing. When in reality, they didn't went to a dentist; they went to a dental technician or dental somebody that that probably just know the work by looking on or something, and they open a business. So ensure that you ask questions, speak to family members and people who are in the dental fraternity. So that's one important thing. The next thing you need to be, second thing to overcome the fear of the dentist, be clear of your fears. If you're going to the dentist, you let he or she know that, hey, I'm afraid of the sound that you guys are using. I'm afraid of the needles, the environment, the smell. I'm afraid of it. And when you do that, the dentist will be able to know how to curb your fears and know how to treat you exactly. So if you're afraid of the needles, one of the things that the dentist would usually do is turn away from you and put the needle behind your back, open it, check it. We do what we have to do in terms of checking to see if the liquid that is present in the syringe, the anesthesia, is coming out properly. And we don't allow the patient to see it. And we just take our fingers, put our hands behind our back, and we just we touch around the mouth, we palpate, we do what is necessary. And then we actually close your eyes, and then we see you're gonna feel a little mosquito pinch, right? And we do away with words like, oh, pain and bore and stuff like that. 'Cause those things kind of cause patients to feel very frightened when you hear the word, oh, I'm gonna bore you and I'm gonna stick you. So we use the words like, you're gonna feel a mosquito pinch, or I'm gonna use the anesthesia. That's what we do so that the patients cannot feel fearful. And then before you know it, you already have the injection inside. And then you, most of the times when we do that, they say you finish already. So be clear of what you're afraid of, and everything is going to be fine. The next thing that you can do to overcome the fear of the dentist is there's many relaxation techniques that you can do. So going to the dentist, walk with your iPad, walk with your phone, walk with your earpieces, so that when you go in the waiting area, plug up your ears with the music, listen to your favorite gospel music, and you just jam to it, and just wait until the receptionist comes to you and say, "Hey, uh, Carly, it's your time to go to the dentist." When you have the music in your ears, it soothes you, it causes you to be relaxed. And you kind of overcome a little bit sometimes the fear of the dentist. And then even when you go to the dental in the office and you sit in the chair, sometimes before the dentist would do their procedure, they would say, you know what, you can listen to your music, plug up. Some dentists tell you to plug up, some dentists prefer you not to. So it all depends on who you go to. But if you want to, you'd say, hey doc, I'm afraid of what's happening, so can I plug up my ears and my earpiece and just listen to some music? And there's a sure, go ahead. So you yeah, you do so, and kind of thing, listen to your podcast, your music, whatever. You can close your eyes, think of some place happy, think of your favorite food, your favorite place you would like to travel, and also you can do some deep breathing. Deep breathing helps a lot. uh, yeah, deep breathing helps a lot because it opens up your ear spaces, and it allows you to think and clear your head and just relax and allow the dentist to do what he or she has to do. Um, Another thing that you can do as well is that you need to not only go when there is a big problem. Sorry. So if you would only go to the dentist every 6 months and just for checkups, this would save you a whole lot of trouble because very small cases can lead to very big cases, and then it's the big cases that causes you to not want to go to the dentist and cause you to say, "Hey, I'm not going there because I don't know what they're gonna do." They might Most persons use the word, "Oh, they might bust my gum." We don't bust the gum. We treat you with intensive care. We do surgical removal. Of course, you're under anesthesia, so you don't feel any pain, and we perform whatever is it that you might do. So ensure that you go every 6 months and not just go when there's a big problem, when there's pain in the nights keeping you up. Right? Make sure you go for your 6 months checkup. And remember what we said before. When you go for checkups, you're not just going to you don't only go for to the dentist to do extractions. You can do preventative care where you do fluoride treatment, where you do cleanings, dental cleanings, and dental polishes. Also, and also just a general checkup to see if there's anything that you can do to remove the caries or the rotten tooth that is present, any small thing, and stuff like that, right? Um, because when you go to the examination um, of the cavity at the dentist, there's many things that you can look for that the dentist looks for. There's cavities, there's gum diseases, and sometimes there's cases where oral cancer might be coming up. And so if you check for these cases very early and you go to the dentist, then it is very easy to go into treatment and not be afraid of the dentist, right? Uh, in terms of being in control, there are certain things that the dentist can do to cause you to overcome the fear, especially for children. Like what we would usually do is give the patient, the children, or if you're big and you're frightened, then no problem. But we would usually give the patient control. We would say, here's what: if you are feeling some type of pain, you raise your hands, and I'll stop immediately. If you are sensing something or feeling some sensitivity, or you're feeling heat, or something that is uncomfortable, raise your left hands or raise your foot, whatever is the instruction the dentist gives, and we will stop. Doing that gives the patient control. Oh, when I stop, he will stop. So good, I good. He not gonna continue, and that makes us feel okay. Good, you were safe, so we were safe, and we don't want to go any farther. And the next thing you know, your patient sues the dentist. So we have to go in accordance to what you see. So giving the patient control of instruction by giving them instructions as to what to do, what not to do, causes them to feel a little bit more secure and a little bit more safe. Another thing that we do is we give the children the mirrors, basically desensitizing them. We show them, hey, this is a mirror. This is a what we would call a probe to check the surfaces of the tooth. The kind of sharp thing you guys see. It's called a dental probe. Um, we give them that, and we say, hey, this is a probe. This is a mirror, and then we give them the mirror to say, hey, you want to see yourself, and we just cause them to be in love with the dentist. Yeah, to be in love with the dentist, and they kind of get a little bit more less stress, less anxiety, and we get to be able to treat them more better. Some chairs now, well, most chairs now in modern day dentistry, they have that little screen or that little mirror that is present on the chair. That screen can show cartoons, it can show movies, whatever, and so the children would usually be fascinated when they see things like Dora, when they see SpongeBob, and so when they see that, they get excited and they want to come to the dentist. So we usually incorporate these things into our care and allow for better dental treatment. So viewers, it is necessary that you visit the dentist, and as I just said, there's many things that can be done so as to overcome the fear of the dentist. Um, and remember, one of the most important things though is prevention is better than cure. So visit the dentist regularly. Call for checkups. Say, hey, if you have a friendly dentist, or you can message me. Hey, I'm noticing X, Y, and Z. Um, what can I do? And then the dentist or whoever you message will be able to reassure you that, hey, that is not a big problem, or that is a big problem. You need to check me out. Blah blah blah, things like that, right? So that's basically it. Doesn't in a nutshell what are some things that you can do to overcome the fear of a dentist. And then if I can answer any questions, no, then we'll move on into some other things.
Yes, I really, really love what you said. I know many times we are definitely afraid to visit our dentist because we are afraid, like you said, for the dentist to really see our for us to expose what
Yeah,
really is happening in our mouth. But it's best for us to go so that the issue can be fixed rather than us delaying and causing a further decay or so to the problem.
yeah,
And like you said, once we visit every 6 months, then of course the dentist would be able to pick up if there is anything that needs urgent attention or
to be done.
so
Yeah.
with our mouth. So we
And another
have,
thing before,
yes, go ahead.
uh, in terms of children as well, because many persons are afraid to take their children as well to the dentist because
Mm-hmm.
they themselves are afraid. And if you, as a parent, is afraid of the dentist, and of course, your children's dental care will be neglected because you're afraid of,
Mm-hmm.
oh, they might do something to my child, whatever the case may be. But once you overcome the fear as a parent, then your child can be able to get the treatment necessary. And once you also encourage them to go to the dentist, then it's very easy for them. And another thing too is you need to do away with certain jargons, like when they misbehave, you use words like, "Oh, I'll take you to the dentist." That
Yes.
kind of triggers something in their brain that hey, oh, the dentist is something bad, and I shouldn't go. I don't want to go to the dentist. And so parents need to ensure that you do not use these jargons on kids. That going to the dentist that makes it seem as if going to the dentist is something bad. Um, so if you want to scold them differently, but do not say, "Oh, I'll take you to the dentist." No, go away with that. And then also, if you're afraid of what might happen, or you're afraid of, oh, the child might behave really really bad, today, modern dentistry, there's something called nitrous oxide that we usually use in children. I don't know if a lot of persons in Guyana does it. Mostly the private clinics would usually do it, because you have to have some form of training and some form of experience when using the nitrous oxide. But basically, what it is it's a gas. Nitrous oxide is a gas, and the gas is usually placed over the patient, the child, um, nose and mouth, and they inhale it, exhale, inhale, and then when they inhale the gas, what happens is that they feel a little bit drowsy. They're still conscious. They can move their tongue and everything, but they behave, they be a little bit droopy, a little bit I feel like I'm sleeping, but they're still conscious. Sometimes they still cry, but not like to the extent that they would go on like really really bad. And nitrous oxide gives us control now, because we can now be able to move their hands without them fighting back and or moving their face, because they're sedated basically. So those are things that can be given, so you don't have to fear of your child be getting dental treatment.
Awesome. I love that. And so we have a question right away about, can a 6 year old go to the dentist for teeth cleaning?
Okay. So yes, 6 year old they can, because I mean they have teeth. At 6 year old you have your teeth, your primary teeth rather, and I don't think it is necessary that you do a the type of cleaning that we would do using the type of instruments that we would use. But there are certain things that the dentist will do using other instruments, like manual instruments, like we use something called scalers to remove the different plaque or whatever is present on it, to remove the whatever debris may be present. So they may have can have cleanings done, but not the regular cleanings that you and I would have, where we would use the something called an ultrasonic scaler, where water comes out and it vibrates. And so we don't really usually use that, because when you do that for adults, we usually go beneath the gum lines and we try to remove whatever debris might be present there. And if you use that for kids, because they're now developing, the teeth are still developing, and there's a permanent tooth below there. Sometimes, if you go too um, hard or put too much pressure on them, it may cause damage to the underlying tissues and the ligaments present there, as well as the permanent tooth. So, um, most of the times, dentists usually use the hand scalers or the instruments we would use in our hands to manually remove whatever is present to have the cleaning done. And then after we do that, we would give the fluoride treatment, so as to give them optimal dental care. Uh, but if it is necessary to use the ultrasonic scalers, because some parents, because of neglect, because the child has dental neglect, they have buildup of plaque, and it's very, very, very yellow and very, very, very thick. And so it is necessary to probably use the ultrasonic scaler. If the dentist is going to use it, then he or she is going to use it at a very light force to get the stuff removed. So yes, 6 year olds can have dental cleaning depending on the state, and yes. Now here you, Carly.
Yes, thank you very much. And so we have a follow up to that question. If the 6 year old has a cavity and intense cleaning at home is not working, what is the next step? What can be done?
Okay, when you say you're intense cleaning at home, meaning that you're brushing regularly, I'll say so, and it's not working. But I mean, if you're doing intense cleaning before the cavity, you would have had a cavity. No, you would have had a cavity. No, so I'm thinking only if the person is asking if they do a intense dental cleaning. No, intense cleaning at home. I'm saying that if you do intense cleaning at home, if you're saying you're doing intense cleaning at home before the cavity would have formed, then you shouldn't have had a cavity. But if you do intense cleaning after the cavity, then cavities don't grow back. Cavities don't cause. If you do brush your teeth regularly, you do intense cleaning, a cavity can just go back on its own. You need to go to the dentist to repair that for the 6 year old. So for cavities, what we would do for cavities in children, we would do fillings, basic fillings, depending on the depth of the cavity. So if it is too deep, sometimes it requires extraction, or sometimes it requires a root canal. But if it is a very shallow cavity, then we can do our regular fillings, not the silver ones, the amalgam stuff. Well, depends on the depth of it. But most of the times we go for something called um, GI we would use, and it's white, and it usually releases fluoride, which helps the patients. So the cavities can be fixed, and if you after you would have fixed it, it is necessary to continue with your intense cleaning at home. But um, the next step would be come to the dentist and get the filling looked after. Yeah.
Yes. And so we have another question, Doc. Does extraction weaken your gum line? And in essence, the other teeth on the particular side of the jaw? So they're asking if the extraction weakens the gum line and the other teeth on that
Okay.
particular side of the jaw.
Thanks for Romel for that question. So first of all, you need to understand a few things before. Your gum line is the gum, and the tooth is in a socket in the gum line. So there's a socket. So let me just give you back the anatomy of it. So there is the bone. There's your bone. Your bone is covered with the gum or the gingiva that we would see. Now, in each bone, there's different segments, and each segment has sockets that the tooth itself goes into. So the tooth is comprised of a crown and a root. The root goes into the socket, and so the gum line, above the gum line, you only see the crown, the white part. The enamel, the crown of the tooth, you only see. In doing extractions, what we basically do is take the forceps, or what would look as a plier. You take that and you put it between the two gum lines. Now the gum line between the tooth, it can be moved. Not you can't move it with your force. We um if we take a probe and we gently just touch it, you see it can move because it's free. It's a free gingiva or a free area to be moved as compared to the ones below and around the oral mucosa. So we take the pliers, go between those two gum lines, and we basically just apply a little bit of pressure, a little bit of force to the tooth. When you do so, we just go side to side, we rock it a little bit, and we loosen basically the tissues below. Doing so causes the tooth to come out of the socket, and that is basically it. So it doesn't cause any um, weakening of the gum line because the gums they are built with collagen or fibers to withstand these different things. And but if there's like any cut or if there's any pressure that the dentist would have had to do to remove that tooth because it was difficult, sometimes we find what happening, the gum lines would probably tear or break. What when that happens, no need to fear because what we would do is suture it back up together to keep it in place. And the gums and the oral mucosa they are epithelium, meaning that they cover the gum and they heal very fast. So that kind of area heal in 2 to 3 days once you follow the instructions given, which is rinse your mouth with warm salt water because that kind of soothes the area and it also aids in something called osmosis to cause the different um, swellings or whatever might happen to ease. And once you follow the instructions, then it goes away. So extractions don't really cause any weakening of the gum line. It probably, if more force is being placed on it, it causes a tear in the gum. And when that happens, then um, another treatment that might have to occur, which is suture, and then 2 3 days it will heal. So no need to fear about of extractions. Yeah,
So we have another question. What are some home remedies that can be used for cavities?
great question. Um, so it all depends again. Well, since you're using the term cavities, just want you to ensure that you know what you're saying because some persons make some cavities and having a decayed tooth. Decayed tooth are those um, black stuff, black things that you see in the grooves of the teeth, and sometimes those brown and soft things that you see in the tooth. Whereas a cavity is a more open, overt something that is open up, with what you would say a hole present, right? So when it comes to cavities, cavities uh, can cause pain or can cause pain, and cavities sometimes when you eat and when you use drink cold or hot food can cause a shocking sensation or so. Some home remedies that you can do, there's many of them, but before I list them, I need you to know home remedies do not replace a dentist. You don't just, not because there's home remedies, you say, oh, I'll just use home remedies and not go to the dentist. Home remedies are so that you can ease the pain during the night or at hand, so that when you go to the dentist, um, things can be better. Or to ease the pain before you go to the dentist, rather. So, some of the home remedies you can do Many persons use clove, and they take the clove whole and just stick it into the cavity, into the hole, because cloves, they have something called eugenol, and eugenol helps to soothe the nerves or soothe the pain present within the tooth. So cloves help a lot, and they have also antioxidants present to ease and to destroy any bacteria present in the that might be causing the pain. So some persons use clove because of the oil present inside. Some persons even actually buy the actual clove oil and put it inside the tooth. And the thing that you guys use that is called what do you call it? Still, no, touch and go, right? The touch and go thing that many persons use in a little small bottle. It contains an oil, and that oil is actually eugenol, which is the that is present in the clove. So this is the clove oil, and they would take the cotton wool and they would put it on the cavity, and it usually eases the pain. However, sometimes that can cause damage to the enamel because of how acidic it is and how it has like a burning sensation. So you need to be careful how you put the clove oil, because sometimes if you put it on your cheeks or your other mucosa, your lips, it can burn it and cause destruction to your tissues. So you gotta be careful when using your clove, as well as your clove oil or your touch and go, whatever you use. That's one. Some persons use garlic. So garlic, you can grate the garlic, put some salt, and mix it up. Yeah, it sounds very nasty, but it usually helps. I would have did it 1 years ago, and it helped. Some persons grate the garlic, put some salt, they mix it, and then they just put a little and stick it in there, and then they keep it there for a good 10 to 15 minutes, and it usually soothes the pain. Remember, home remedies are just to help temporary, because um, chances are the pain might come back or will come back. So you need to visit the dentist immediately when there's a pain. It's just to help you to temporarily ease the pain. Uh, what are some other things that you can do? Hmm. There's some plants that people use. I don't. There's mint plants and mint leaves that persons would use to bite on it, and to cause and kind of soothe the reaction. It doesn't stop the pain, but it soothes the area, right? So then you can use your mint leaves to help as well. And if these little things that you don't do at home doesn't help, use your regular medications, your Pandol or your ibuprofen. Some persons are allergic to ibuprofen or Pandol, so whichever one suits you, you use it. If they're not working, it therefore means it's necessary to use it to go to the dentist, because usually um, medications like Panadol and ibuprofen and stuff like that, they help to ease pains that are reversible. Because when we diagnose the patient, there's pain that are reversible, meaning that, oh, when I remove the stimulus, if it's a cold stuff or whatever, it shocks a little bit and removes. It stops immediately when I remove that stimulus. While there's some that, oh, it wakes you up in the night and it goes for hours and half an hour and keeps you up. That is necessary to go to the dentist to check it out. And pain medications usually don't help those. So if you use medication and you realize it's not helping after 2 to 3 hours, then my friend, check out the dentist the next day immediately. So that are some of the remedies you can do. Some persons use alcohol. Like I heard somebody say, a patient said to me one time, "Oh, I don't usually come to the dentist because I take me shot of high wine and I rinse with high wine. I don't recommend. I don't know if it helps, but he said it helps, and I don't recommend nobody using any alcohol or high wine to do so, because many persons I heard say that it helps, but if it helps, I personally do not recommend you do so, because it is alcohol, and it can cause some damage, severe damage to the actual enamel of the tooth, weaken the tooth structure, cause sensitivity, and stuff like that. So to prevent all of those, just visit the dentist. Oh, so that is the home
Awesome. And
remedy.
I love how you're emphasizing that the home remedy is not the final answer. It's just a temporary relief it will give you, but you need to visit your dentist so that
Yeah.
you can receive the necessary help that you need in that particular um, issue or area. And so we have another question, Dr. David. This
Uh,
question is how to remove plaque. Is it the same way that you just explained? Someone is asking, how do we remove plaque? And they're asking without visiting the dentist.
oh, so you need to first understand the difference between what you're seeing, because not because you're seeing a yellow substance that is seemingly hard or so, and you call it plaque. There's plaque and
Mm-hmm.
there's calculus. Plaque is the, for lack of a better word, when you take your hand, you scrape your mouth, you see something that people would say cheese, then that little
Mm-hmm.
soft something is called plaque. However, if you do not brush your teeth over a period of time, or you don't go to the dentist for dental cleanings, the plaque goes is located below the gum line, and if that is not removed, um, if that is not removed, then it becomes very hard. And when it becomes hard, it is called calculus or tartar, and that cannot be removed on its own. You cannot remove that at home by yourself. You have to go to the dentist to do a dental cleaning. But the regular plaque that you would find that is very soft can be removed by brushing your teeth and can be removed by flossing. Period. That's it. That's why we brush your teeth. We brush the teeth to remove the plaques, and plaque needs to be removed frequently. So after, because remember when we discussed earlier how plaques are formed. When you eat the food stays between the grooves, the fissures, and between two teeth. And when it stays between there, you do not remove them, whether by flossing or brushing, stays there. Food becomes decayed. Bacteria comes, feed on the decayed food, and releases acid. And that acid now causes the tooth to now be broken down into pieces and be broken down and be demineralized, meaning that it becomes very weak now. It's not strong as it should be. And when that happens, the process continues, and then a big cavity is formed because now the enamel that's supposed to be very hard is now soft and is now brittle and it breaks. And when it breaks, a cavity is formed. So it all starts with removing the food very early and flossing and brushing twice daily. If you could brush it twice, that's fine. That's perfect. And remember, um, I said before on the last show, it is not a shame. You shouldn't be ashamed to take it to brush to your workplace and brush your teeth. After lunch, come brush your teeth. Is your teeth. You are the person that needs the care. So take it to the brush, remove it, floss daily. I'm sure some of you are watching in this live in floss in days. I hear you, Carly.
Thank you very much. I love that very much. And so David is encouraging us. So do not be afraid to take our toothbrushes or toothpaste in our workplaces to work. And after lunch, just brush your teeth. That doesn't mean that you have bad breath or anything. It
Uh,
just means that you're taking very good care of your oral health. And it's very much important. And of course, we talk extensively in the previous programs and so on about flossing, the importance of flossing after every meal. And so here is someone have another question, and Lorianne is asking, is it true that chewing chicken bone damages the enamel on your teeth and causes cavity? Is that true?
so thanks, Lorian. Chicken bone. Hmm. Chicken bone cannot cause cavities. However, if you have very soft, brittle,
Hmm.
enamel, sorry, and the bone is very, very hard, and you're biting and you're breaking and biting on the bone, you can cause fracture or crack to the enamel. That's because of the force placed from biting, and also because of the weak structure of your teeth. But your teeth wouldn't become that weak if you would have flossed and brushed and have your fluoride treatment necessary. But chicken bone in itself can't cause um, damage to the enamel only if you bite so hard and you are. But
Hmm.
in reality, it can't just cause that unless you have weak enamel or weak teeth. However, I just recommend you take your time on the bone. Take your time if you on the bone. Don't do not put a lot of force on the tooth. Just take your time on the bone. I hit me bone. I don't like, and it can cause cavity. And remember what we said earlier just now. Cavities are formed when the plaque um, would cause demineralization, and then it starts to break down after a period of time, and then a big hole forms. And that's why when you look into some person's mouth or me, the dentist, when you look into the cavity, you see black stuff below. That's because the plaque now has become so hard and becomes the caries that become so hard, and it now turns to calculus and all these different things. So a bone in reality can't cause a cavity. It can cause fracture or it can cause cracks
Yeah,
if you put
okay.
a lot of force. Yeah.
So we have a viewer saying, "Leave the bones alone." Oh my gosh, that is so hard to do. It is so hard to do. I love my bones too. I love to chew on my bones, man. But
Just take your time.
since we're talking
Uh-huh.
about biting our bones, what about persons who love to open? They would open the drink bottle, the
Oh
cork
my
of the
God.
bottle with their using
Listen,
their teeth. What about that? How damaging can that be for our
listen.
teeth?
I hate when I see that thing. The thing I cringe because I know the effect that it has on the patient's tooth
Mm-hmm.
structure. Now, you let me just break it up. So you gotta open a bottle drink. You gotta open a shandy, and you're gonna take the tooth, and then you're gonna. And when you do that, I mean, it opens. However, doing that, it is kind of like similar to the bone situation, but in a more detrimental way. Doing this causes the cork and the tooth kind of acts as like a fulcrum, and you have to apply pressure on that tooth. When you do so, you
Mm-hmm.
cause the ligaments below the tooth. Because remember, I said there's the crown, there's the root, below there's fibers and ligaments to keep that tooth in place. When you bite on the tooth and you put excessive amount of force, it causes the tooth below to loosen. And once that loosen, you find after a period of time, the tooth that you usually bite on, and most persons bite on this side, like the premolars,
Yes.
they bite on that side. When you do that, what you find happening is that it loosens the tooth, and the tooth starts to become very mobile, and it shakes. And you're like, "What's happening to me?" It's because you're opening the bottle at the time. So, uh, no, do away with that. That is not good. Do away with it. Get an opener. Go to the shop, ask them to open it. You do not use the teeth to open it. Your teeth are used for pronunciation of words, for chewing your teeth during mastication, and for pronouncing proper phonetics and stuff like that, and for smile aesthetics. So, not to open bottles. So, if you need to open a bottle, go and get the opener because you damage the structures below, causing weakening of the tooth structure. And also, it can cause fracture as well. It can cause fracture because of the force present on the tooth surface. So please don't do that.
All right.
Yeah.
And then we have, I guess Akeem came a little late. So Akeem is asking, can I use medication at home to relax before visiting the dentist? I guess he was talking when he's asking this question based on when you were talking about the home remedy and
Oh
so on.
well, I would have said earlier that the dentist would use nitrous oxide treatment to cause it to be relaxed. But some patients, because of, like, for example, persons who have Down syndrome or have other different medical problems, what you
Mm-hmm.
find happening is that the dentist would recommend, hey, I'm going to give you this medication to use hours before you come to me. So when you use this medication, you feel sedated. Uh, we call them barbiturates, and it's like basically not sleeping pills, but medications to make you feel sedated. So there's medications that you can use, but not you on your own. The dentist must recommend this to you. The dentist must say, okay, I'm going to give you XYZ and prescribe this for you so that you can feel a little bit relaxed when you come to the dentist. And it usually helps with your anxiety and usually helps with the fear of the dentist. Especially patients like I was saying that have Down syndrome or autistic patients that have to seek treatment, and because they're afraid or you don't want them to have any pressure or any severe thing on their brain or on their mind or anxiety problem to cause them to go into any other problem, you give them the medication to feel a little bit relaxed before they come to you. So that's the great. That's
I
the
love it. Uh-huh. Awesome. So, doctor, before you continue sharing on oral health, share with us again some of the things that we must do to take care of our oral health, which is visit the doctor every 6 months,
uh-huh.
etc., etc. Just share those with us
Yeah.
again.
So I'll always emphasize when I see people, it is necessary to do the basic stuff. Floss regularly after meals, brush your teeth. If you would like to use your mouth rinses, use your mouth rinses. But mouth rinses should not replace toothbrushing. Mouth rinses are just to aid in removal, or after you would have eaten quickly and you don't have the time to brush, you use your mouth rinses to just rinse out your mouth so that the food debris can remove out. Visit the dentist every 6 months, like I said, for your regular checkups, or like they'll do an oral examination to check for everything. If you need a filling, if you need a root canal, if you need whatever the case may be, they do a general check. Ensure that you have a cleaning done every 6 months, because cleaning helps to prevent gum diseases as well. Because cleaning helps to remove the underlying plaque that is present, or calculus that you cannot remove at home. So going to the dentist every 6 months helps with that. Be sure to also uh, find out what else can be done. For example, if can I do a fluoride treatment, and get the fluoride treatment done, because fluoride treatment helps to strengthen the tooth enamel, and all these things would help to prevent from getting caries and rotten tooth, right? Uh, and that's based. Oh, and then also ensure that you when after you would have binge watching series and while eating popcorn and your slight snacks, you brush your teeth and remove the sweet and remove all the different debris that might be present between the food, right? Try not to do any habits, like bad habits, like opening the cork of the bottle with your teeth. Uh, do away also. I always encourage parents, especially with habits that children might be doing, like thumb sucking and tongue sucking, stuff like that. Do away with those things like that, because or try to not cause your children to do it. There's different remedies you can do to cause them not to suck their tongue or suck their tongue. Because what you find happening is that when they do that, they after a period of time, the tooth, because of the force present, because if you take your tongue and you put it in the mouth, the force present there continually causes the tooth to shift and move. So instead of it being like this, it's supposed to be overlapping like this. You find what happens after you suck your tongue or your teeth, it moves, and then you find the person having a more protruding mouth. So these habits, try to do away with it, and then ensure you monitor your children when they're brushing, because you don't want them to swallow the fluoride, because fluoride can cause other detrimental problems at a later age, because as a young child you're developing, and when they're developing, and too much fluoride rather can cause effects on the permanent tooth below. So you want to do away with these different things. And also, you need to ensure to eat properly as well, because there's some food that you're eating that can cause severe decay. For example, drinking a lot of Coke. Coke has a lot of sugar. Using a lot of sweet things, cheesecake, your cookies, using these things quite often and frequently, that is a problem. Using it frequently, because there's no harm in using it. But if you're going to use it, brush or wash your mouth out afterwards, and not use it every frequently. That's why there are timings. There's breakfast, then there's brunch until 10, then there's lunch, and then there's dinner until a little later time. So you need to watch how frequent you eat your food. And when you're eating, it's always recommended that you use healthy foods. Use food that contains many fibers. Use your celery, your lettuce, your vegetables. These things help to strengthen your teeth, and more so, te- foods that are high in fiber, they help to strengthen your gum mostly. It's your gum that usually needs strengthening with fibery foods. Foods for your crowns and your enamels, you use more milk. Use more cheese that has calcium, um, and stuff like that. Nuts.
Yes, very informative, very, very informative. And so we have another question which you just talked about easing, not using too much of soda, too much of sweetie food and things like that. Can using too much of fruits damage the enamel? You know, fruits, there's a lot of sugar in some of the
Uh,
fruit. So, yes.
Well, you see, the thing is, when it comes to fruits, there's different types of sugars. There's your glucose, fructose, lactose. Glucose are found, and sucrose as well. Glucose and sucrose are mostly found in your bakes, cookies, Coke, sweet drinks, etc. Fructose are found in your fruits. Glucose and sucrose are more detrimental than your fructose and your lactose. Your is the one that is least cardiogenic, meaning the least likely to cause rotten tooth. But the glucose and the sucrose is 10 times more causing the damage to the tooth. So let's say the fructose and the glucose present in your sugary foods like your Coke and your cheesecake and whatnot. Let's say that is like 100%. Fructose is about 30% causing damage, and lactose is like about 10%. So your fruits usually do not cause that much damage to your teeth. Um, but still, it is recommended after using your fruits, you wash your mouth out afterwards, or you just floss afterwards. But it doesn't cause like a detrimental effect on the tooth like your glucose. Your lactose aids in strengthening the tooth because of the calcium in the milk and everything. So that is that. But when it comes to fruits, however, though, there are some fruits that are very acidic and because of the citrusness of it. For example, lime. Lime is very, very acidic, and the acidity can cause um, damage to the enamel, causing desensitization, sorry, not desensitization, sorry, causing sensitivity to the tooth, and it causes the patient to feel a little bit of pain. Persons who would usually like suck on lime and lemon very raw, uh, you find that happening to them. Or persons who use swank every single day, or use swank or lemon juice a lot, they would usually be the ones that have that kind of effect on their tooth structure. But fruits in itself cannot just cause caries. I mean, over a period of time, if you don't remove it, brush your teeth afterwards, and of course, because it contains fructose, which is type of sugar, but it's not that detrimental like the glucose and the fructose and the sucrose present in the other sugary foods.
Yes, this is so informative. I'm telling you, we are learning how to take very good care of our oral hygiene. And so we have another question before you continue your presentation. If someone has a permanent tooth and it's leaning but not shaky, what can be done?
If someone has a permanent tooth and it's leaning but not shaky, what can be
Mm-hmm.
done? Leaning in the sense of it is I'm getting leaning in the sense of it is not in the correct position. So the teeth
Correct.
are supposed to be aligned in the arch in a specific way. And if it is leaning, then treatment needs to be done. Orthodontic treatment needs to be done, meaning braces need to be done. So
Mm-hmm.
if you say it's not shaking, then you need to visit the dentist anyway. If it was shaking or not, once it's leaning, you need to visit the dentist, and you can't treat that by yourself. It's either you need a in the case if it's malposition, meaning it's out of line or it's malaligned, it's out of the position of the arch, then you need to do orthodontic treatment. So, meaning braces to get it in line. Or if it was shaking, it's leaning and it's kind of shaking, it therefore means that there is some problem beneath that we would call periodontal problems. Periodontal is a big word for gum disease or gum line stuff. So probably some gum disease is forming below, um, and you need to seek dentist immediately. So if it's leaning, visit the dentist. It needs to be shifted back in line, because if it's usually malaligned teeth has gives problems with eating. It
Mm-hmm.
gives problems with um, when you speak, because you can't get to pronounce or enunciate your words properly, because the teeth helps to pronounce words like to and that, and because the tongue goes behind lingually behind the tooth. So you need to see the dentist to check out what is necessary. And unless the dentist see exactly what you're saying, Juliet, for your
Mm-hmm.
brother, then I can't be able to give you like a song direction what to do, right?
All right, and so we have the doc in the house overcoming the fear of the dentist. Of course, today we're looking at oral health, how to take care of our oral health. And Dr. David is right here, virtually in studio, virtually sharing with us some tips and what we can do to overcoming the fear of visiting the dentist. We know it's quarantine time. The dental school it's not working as regular, but of course, we are phasing out this quarantine. And so
Yes.
I'm sure after quarantine, you would want to go and check. I'm sure the 6 months, depending on when last you visited the dentist, you would want to go check and ensure that, everything is okay. And you heard the doctor saying you don't wait until the problem is escalated before you visit the dentist. But once you maintain your regular checks every 6 months, and of course, it's not only for the adults, but also for the children, then
Yes.
you are preventing a whole lot of damages from occurring in your mouth. And so it's very important for you to visit a dentist. It's very important for you to brush daily, at least twice per day. He recommends even thrice would be good once you take your toothbrush to work. And don't be afraid to pull it out of the bag, put toothpaste on it, and go
Definitely.
ahead and brush, not scrub. Remember, he said we're not
Yeah.
scrubbing anything, but we're brushing our
Gent-
teeth. And
That's
of course, he talked about flossing, the importance of doing that after every meal, doc, after every meal. And so he's sharing some tips with us as to how we can overcome the fear of the dentist. So as we're getting ready to put a wrap on today's program, doc, go right ahead if you have any final few comments or words or advice that you would like to leave with us on today's program.
okay. So let me just put out there that like you were mentioning, Carlene, that we within school is now working as per normal,
Mm-hmm.
and we're trying to face out this quarantine, this coronavirus, and it's gonna go. But in the meantime, because we are all at home and most of us are at home resting while some of us are at work. Um, Try to ensure that you maintain brushing and flossing regularly. Since you're at home, many of you had never flossed before or don't floss regularly, make it a practice now that you're at home. Get the floss and just keep it there on your breakfast table so that when you get up and after you eat, oh, okay, I have to think. Or set reminders that, hey, I have to brush, I have to floss, or I have to do whatever dental treatment today. So ensure at this particular time you're in quarantine. Many of us are watching a lot of shows and we're eating frequently. Try not to eat frequently. Eat when you're hungry or when necessary. Um, and because I don't want to go back into the entire way how it works, but frequent frequent eating is what actually causes the cavities to form. We usually tell person if you want to eat your sugar, eat everything one time and done. Don't eat it at 10 o'clock and then eat it at 10:15 and then eat it at 10:30 and then 11. Don't do that because that's frequent eating and frequent eating can cause more damages to teeth. Um, the dental school, just for people viewers out there, you might have a problem. The dental school is still working from 8 to 12. They are not doing any dental cleanings at this moment because of the aerosols or the sprays that will come out rather from the sprays, and we want to minimize the curve of the coronavirus. We don't want anything spraying and catching, and put us at risk as well as you at risk. So we're not doing any procedures like that. We're doing um, emergencies. So an emergency would be if you or your child would have fallen on the ground and would have caused your tooth to be fractured or broken. Immediately you go, you'll get treatment. If there's a wisdom tooth that is giving you hell in the night, visit the dentist. That's the emergency. If there's a swelling that is paining a lot in your neck, by your jaws, or in your tooth areas, or you go to the dentist. They will look you after, or an abscess present, they will look you after. But if you are not comfortable with going to dental school, you can go to a private dentist. There's many private dentists. You can check on Facebook. I wouldn't recommend tell you who to go to, but I can just list some of the people that there is if you want to know some dentists to go to. In this period, there's Dr. Sen Gupta and Associates present. You can check them out on Facebook. There's Smile Guyana. There's Smile Designers. There is the Cherry Jagan Dental School at Tutrama, Charlotte Street. There is Dr. Stewart's clinic that is present in Alexander Street as well. No, Charlotte Street as well, sorry. Uh, there's the Jagans that are present in Lamaha. And there's a dental school. So it's your preference. And remember, like I said before, research the persons you are going to before you just visit a dentist. Research and ensure that, who I'm going to is they have the credentials. Who I'm going to, many persons would have given good reviews. Ask your family members. Ask persons who might would have had gone to somebody before about this person. Can I go? How was your experience? And if they had a really good experience, then you can try them out. If you have the finance, I always recommend and say, okay, go ahead, go to the private dentist. Private dentist usually has a good vibe and a really nice atmosphere. A lot of persons usually don't go, so you won't be going to see a lot of persons there, and then you're afraid and you're crying like the public. So and remember the tips that I would have left earlier, which is ask questions, do your research, um, be clear and truthful to the dentist as to what you're afraid of. Listen to your music or your podcast while waiting on the dentist. Ensure that you do your research on whatever procedure that might have to be done. And remember also, if the dentist says, "Oh, you need to do an extraction," you can take your time. As in, when I say take your time, as in if you go today and they say, "Oh, you might have to do an extraction today," You can say, okay, no, I just want to know what can be done, so I'll take some time, think about it, and then I'll come back. But don't take too long because that can cause detrimental effects on your teeth. So you can take your time. It's your body, it's your teeth. Think, okay, I'm going to do it. Clear up your mind, get yourself confident, and then go and visit the dentist. And to be honest, let me tell you something. If it's because y'all never went to me, y'all thinking that is a bad person. Come to me and you could see. Because I always try to ensure that patients have a really, really good, time with the dentist. And it's usually the dentist usually have the kind of have an effect on the people. And if you know the person or you kind of have that, you kind of feel safer. I recommend you go to that person because that's who you trust and that's who you not gonna have any other problems or anxiety with. So do your research, and remember, there's no need to go to the dentist. The dentist is just like a regular physician that you go to for checkups. And not because you're going to the dentist, it means you're going for a problem. You can just get up today and say, hey, I want to know what's happening with my teeth. I want to ensure that I'm having a good smile. I want to ensure that that everything is okay with me. I want to be fit, mind, body, soul, spiritual, and my oral health and general health. And I think in closing, I just want to say that it's necessary to go to the dentist as well because the mouth is the mirror to the body. I'm say it again, the mouth is the mirror to the body. Most of the times, you find that persons that have general problems, whether it be cold, flu, some form of sickness, appears in the mouth, in sores, in cankers, in either the teeth kind of looks kind of pale, either the lips look kind of dry, either the throat feels some type of way, and that's because and that's like the mouth being the oral cavity being like a mirror. Oh, this is what's happening. Something is happening in my body, so I need to get both looked after. So when you start seeing certain things in your mouth, because for example, some person that might have fever, they have like cankers, or some person have like these small little sores, or sometimes the mouth bursts up or bleeds because they lack in vitamin C, that we would call scurvy. So the mouth is the mirror to the body, and it's necessary to do your checkups so that you can know what's happening with both your oral cavity and your general health.
Yes, thank you very much, Dr. David. And well said. The mouth is the mirror to your body. I love that. I really, really love that. But we have one more question, Doc, before you
No
go.
problem.
Juliet is asking how good are those electric floss kits?
I didn't get, sorry, what are those?
Electric floss kits. The electric floss
Oh,
kits.
oh,
How good are those?
I've never really seen used that much. I've never used that at all. I've seen it from reading it from textbooks and from my lectures, but I've never really used it to give you a good idea as to how well it's used. I can maybe just ask persons who would have used it and then get back to you. But if it's a floss and it's job, I'd say, and it's not causing any other effect on your mouth, as in any sensitivity, or it's not causing any pain or so, then I'd say why not use it? And most of the times from reading and what I understand of how it works is that it moves more a bit more faster, or it does the job a little bit more um, not better, but more efficiently than when we would go and do the floss on our own, because sometimes we miss spots, and I think the electric floss kind of gets all the grooves and everything. So if it does not cause any effect on your oral mucosa, meaning the cheek, the lips, and every other organs in the mouth, then go ahead. Why not use it? But I've never really used it personally, or I've never really heard many persons using it. So I can't really give you much to say about it. If you understand.
All right. Thank you very much, Doctor, for joining us this evening and sharing tips to overcoming fear when visiting the dentist, and of course, always giving us our tips on how we can maintain our oral health. Has been very, very informative, and it's always a pleasure when we have you on the program cheering us on. And I'm definitely, guys, recommending as soon as this quarantine is over, soon as we are out from lockdown, go visit your dentist. Go, for those of you in Guyana, feel free to visit Dr. David. Yes, at a dental school. Ask specifically for him, and he's going to make you feel so comfortable and at ease. Yes, for those of you out of Guyana, ensure that you check in with your dental physician for any any checkups and things like that.
Yes.
Good. So, what about toothpicks? Someone is asking, what about toothpicks? Can we use toothpicks?
Um,
Does that do a good job or not?
toothpicks work, but does not help a lot like the way the floss does. And sometimes some
So,
persons use toothpicks really wrong. Just take a toothpick
mhm,
and they force it between and like they damage the gum beneath. And when they also do that, they also cause because of how thick the toothpicks are, they sometimes cause
mhm.
the teeth to spread out or to cause it to shift and causes spaces to be placed there. And when that happens, food is easily um gets between there and cause the different damages to the tooth. So toothpicks, be careful when you're using it. I don't use toothpicks because my floss helps a lot. So I guess it's a form of preference. But I'll just say that the force, be careful you're using it, not put a lot of pressure when using it because it can cause damages to the gum line.
But floss is definitely the
So
best thing to
floss is
do.
the key. Floss like a boss.
Floss is like the boss. Yeah, so we want to thank you very much, Doc, for joining us today on the
No
Pastor K
problem.
Show, sharing with us how we can overcome the fear of the dentist. Thank you so very much.
You're
Has
welcome.
been a pleasure as usual. And viewers, I really want to thank you for asking your questions. Doc was able to answer. Continue to maintain your oral health. Do whatever you have to while you're at home. Remember that does not replace you visiting the doctor, but ensure as soon as you can, just go right out and visit your dental
Dentist.
physician as soon as this quarantine is over. But in the meantime and in between time, go right ahead. You brush every day, floss every after every meal rather. So definitely it's every day. And for those of you who are working not from home in your workplaces, don't be afraid to walk with your toothbrush and your toothpaste and take it out after lunch or so. And
Yes.
do what you would usually do. And remember, you're brushing, you're not scrubbing, so take your time. It's not
Gently.
clothes we're dealing with. And of course, like the doc said, it's very, very important for us to pay very keen attention to our oral health. Every 6 months, we need to go do a checkup, ensure that everything is intact so that a dentist would be able to see if there's any major work or improvement that is needed at
Yes.
the time rather than waiting for the tooth or the teeth to decay in
Yes.
a real terrible state. So let's visit our dental physician as early as possible, and this is for both children and adults. And of course, you would want to visit someone like Dr. David. Yes. So I want to thank you very much, David, for joining us this afternoon on the program. It's always a privilege and a blessing. And this is your fourth year.
This is my fourth year. I graduating next year, and I can't wait. But
Yeah.
as
We
it is now, I just have to wait until everything boils down. I'm still having courses. I'm still having my. We usually would have cases to just go through and just discuss and exams and tests. So I'm still reading and everything, still watching videos, learning every single day, and come next year. Well, sorry, come September, I'm going to be an intern, and
yeah.
I'll just be working, working until
Yeah, well, we're
graduation.
wishing you all the best, David. We're wishing you all the best distinction. We can't wait as well
Amen.
when you have your own business. Of
Yes.
course, we know that God is definitely going to do great things with you. You're doing a fantastic job
Thank
explaining
you.
so very easy and making it seem very easy to visit the dentist. I think you're doing a tremendous job. So continue the good work that you're doing, and we love you.
I will. Thank you.
Thank you, Doc. So there you got it from Dr. David Adams. Yes, sharing with us tips to us. Sharing with us overcoming the fear of the dentist. And so we want to thank you very much for tuning in this evening, this afternoon, to another edition of the Pastor K Show. See you on Monday, where we'll be having another powerful, impacting, life transforming program on the Pastor K Show. Thank all of you for joining us and enjoy the rest of your Saturday afternoon. Yes, Stacy Blessings, Rhonda Paul, Akeem, Fiona. Yes, Rebecca, how are you? Shondell, Juliet, thank all of you. Simon, thanks for asking your questions. I see you responded, which means that you were very clear. The response you received was very clear. And so, yeah, we're on a journey of maintaining our oral health. Lorianne and others, thank you all for asking your questions. And may the Lord bless you. Enjoy the rest of your Saturday. Until Monday, do have a great splendor weekend. The Lord bless each and every one of you.